Before you pick up that nail file or your brush, you need to know exactly what is underneath your client's nail polish. In today's video, I'm breaking down nail structure, exactly how you would learn it in nail school, and how to tell the difference between a nail disease and a nail disorder, and what you as a professional should be able to work on and what you can't work on. And we'll also go over some of the most common nail conditions that you will come in contact with as a nail professional. So this way you can know when it's safe to proceed or when to send your client running to the doctor. Let's get into it right now. Hey guys, welcome back to my channel. If you are new here, what's up? Do not forget to hit the like and the subscribe button, and don't forget to hit the notification bell so you can be notified when I post new videos every week. If you are new here, my name is Keisha. I am a licensed nail technician for more than 25 years. I am a New York State licensed nail educator of the Nail Technology Program. I am a YouTuber and content creator, and I currently run my own at-home nail business. So if you are looking to level yourself up, get a little bit of knowledge, learn some tips, tricks, and fun things, then you need to lock it in every single week when I post that type of content. If you are not new here, you might have seen an older video that I've done where I spoke about nail structure, nail diseases, and nail disorders, but we gotta bring it, we gotta update things. You know, things change, we can do things better now. So I wanted to touch on this topic first. This is the first video of a new series that I'm going to be running called Nail Academy, where we're going to be talking about all the things that I discuss in school with my students in class that you as a nail professional need to know. So whether you've already been to nail school or maybe you haven't ventured into nail school just yet, these are all going to be topics that you need to know. So consider this a refresher course or a beginner course, whatever you want to call it. Nail Academy is going to be crucial to you developing and growing your skills and your education as a nail technician. So not only will I be producing one video every single week for the month of September, but I'm also going to leave in the description box below some type of handout or educational content that I gave to my students in class that I have on hand that I want to share with you guys as well. So let's get into nail structure, diseases, and disorders now. So before we can talk about diseases and disorders and what that actually means, we need to know about nail structure. Nail structure and the different components that make up the nail. So the natural nail is what we call the nail unit. Is going to be our basic foundation. So we need to know the proper names and functions of each of those before we jump into anything else that we're going to be talking about. So here's the breakdown. The first thing is we have the nail plate. So the nail plate is going to be the visible part of the nail, the part that we actually polish. It's made of keratin and it has nerves and blood vessels in it. Then we have the nail bed. This is going to be underneath the nail plate, and this is what supplies all the nutrients. It's very rich in blood vessels, and this is why your nails look pink. So a lot of times you'll see nail plate and nail bed always get confused and people say the wrong term. The best way I can always explain this to students is think about nail bed as a bed frame. If we have our bed frame, what goes on top of the bed frame? Your mattress. Your nail plate is like the mattress. The nail bed is like your bed frame. Then we have our matrix. So your matrix is the growth center of your nail. This is hidden underneath the skin at its base. And any type of damage to your nail matrix can be permanent. And this is what can actually change the shape and the structure of your actual nail. Then we have our cuticle. So our cuticle is that thin layer of dead skin that's on the nail plate that acts as a barrier against infection. This is what we technically cut when we are providing a manicure service because this is dead tissue. Not to be confused with the eponychium. So like nail plate and nail bed, cuticle and eponychium definitely get thrown around and it could be very misinterpreted. So your eponychium is the living skin at the base of the nail plate that protects your matrix. So this is why it is very important when you are pushing back that eponychium to reveal the cuticle. We are only cutting the cuticle. We don't want to cut that eponychium. This is our defense mechanism so that if anything gets onto my hands or my nails, I'm not going to be infected. Because again, what did I just say? If that eponychium is compromised and we get an infection and it infects our matrix, that can be permanent damage that can change our nail structure and texture. So it's very important to know the two differences between eponychium and cuticle so you aren't harming your customer or leaving them very vulnerable. Then we have the hyponychium. So this is the living skin that is underneath our free edge at our fingertips. So if you turn your fingers over, you'll see that you have some type of skin that grows up, and some people have high hyponychium, some people have regular hyponychiums. You might not see it. I know for me, it wasn't until I started growing my nails out that I actually noticed when my nails grow out, my hyponychium actually grows with it. When I keep my nails short for many years, I never saw my hyponychium. You'll also notice on some clients, maybe it's just the pinkies that have high hyponychiums and every other finger is low. So you want to make sure that when you are cutting someone's nails, always, always, always look underneath just to make sure, because sometimes it can be very deceiving from this angle. So we want to just flip their hand over, check all fingers out before I cut any natural nail to make sure that we're not cutting that hyponychium, because just like the eponychium, our hyponychium is skin that is there to protect the nail plate. So if anything gets inside, it's not going to get onto the nail plate because that hyponychium skin is there to protect it. Then we have our free edge. So your free edge is the part of the nail that extends beyond your fingertip. This is the part that we usually shape and file. So anything from when you turn the hand over that is revealed from here to here, that is considered your free edge. So the next thing we have is the lanula. So this is the whitish half moon shape that you sometimes see at the base of the nail plate. So if you've ever seen someone's nails and they have kind of a half moon shape right here, or you've seen it in pictures, that is your lanula. So that is actually what the matrix is. So think about that half circle being a full circle. The other half is the part that we don't see, and the part that we do see is the lanula. So guys, knowing these terms are super important. It's not just knowing them for your state boards or for any type of test that you're going to be taking while in school. We need to know this so we can sound professional, we can sound educated. And I'm guarantee you at some point in your career, if it hasn't happened already, a client is going to say, why do my fingers have that white thing on it? What is this? What is this circle? What is that skin that grows underneath there? To be a professional and say, I don't know what that is, or I can't really explain that, I'm not sure. It's not a good look. So we want to make sure that we're sounding professional. We can educate clients and educate ourselves as well. So knowing these terms are going to be super crucial to your education and your career. So now let's talk about something that's very important, your nail diseases versus disorder. Do you know the difference between a nail disease and a nail disorder? Let's get into it. So here's what we teach in nail school. A nail disease is going to be usually caused by some type of bacteria, fungus, or a virus. It can be contagious and harmful, and you can not work on a nail disease, period. Working on any type of nail disease can highly spread infection to you, your tools, and possibly other clients. A nail disorder now is a condition that is going to change the nail's appearance or its growth, but it isn't necessarily caused by some type of active infection. So many nail disorders are actually very harmless, and they can be worked on with some type of modification. So here's just a little rule of thumb. If you check out a nail and it's red, swollen, warm, painful, oozing, or has any type of odor, immediately stop working on that client and refer them to a doctor. However, if you notice it's just a change in shape or texture or color without any visible signs of infection, you most likely can proceed again with some type of modifications as to what type of service you're going to be providing for them. So let's give a quick breakdown on things that you can work on. So we are allowed to work on minor surface damage. So this is any like ridges, peeling, anything of that sort. Discoloration from maybe polish or staining. Sometimes people go to the nail salon and they don't use base coat. Again, I saw this more back in the day before gel polish. When you polish with a dark color with regular nail polish, it can tend to stain the nails. Or you have clients that do their own nails or feet at home and it will stain the nails. That's perfectly fine, and most of the time a quick buffing, filing will get rid of that type of discoloration, so you're fine to work on those clients. Thickened nails that could be due to age or trauma, we can work on those. However, side note, just be very mindful. My rule of thumb for thickened nails, especially in the toenails, especially in seniors, people that are anywhere from about 55 to 60 plus, you might experience some type of thickened toenails. If my nail clipper cannot fit to cut the nail down, refer them to a podiatrist. That means that you need a special tool to cut that nail down. You should not attempt to do anything to that nail, because what happens in a thickened nail is now we have many fibers, we have the keratin, we can cut something, we're going to start to, if you've ever filed it, you'll notice it almost deteriorates. If you file on top, you'll notice it gets weaker. So that's outside of our practice and we don't want to really touch that too much. Or if you notice anybody that has any type of minor lifting, but it doesn't seem to be infected. So if you see the nail plate separating from the nail bed and it's not really an infectious situation, it doesn't hurt them, then you're okay to work on them as well. What we don't want to work on is anybody that has signs of a fungus. So yellow, green, crumbly, separating from the nail bed. In addition to all those things, any type of bacterial infection, so any type of green nail that isn't superficial, or if it's in its later stages, we always say we have the greeny, but if it's yellow, greenish, those are the beginning signs. If it's brown and blackish, walk away. If it's pussy, if it's swelling, warts, or any type of growth around the nail, we want to stay away from. Open cuts or sores in any shape, way, or form around the nail area, we don't want to touch. Or anybody that's in any type of severe pain or that has inflammation. These are things that we will not work on. I don't care what your clients tell you. People will lie. They will just lie to get their nails done. You can say you can come back to me when that heals, or we can do every finger but that finger. Don't touch it, because guess what? I always say, guys, if something goes wrong, guess whose fault it's going to be? People see certain situations nowadays as an easy lawsuit, an easy way to attack somebody, an easy way to blame somebody. And instead of taking accountability for themselves and saying, I should not have gotten my nails done, somebody might point the finger at you and say, well, you're the professional, you should have known better, so I'm blaming you that it got infected. Don't bother. And when in doubt, do not risk it. Always refer them to a doctor. It's not worth it in the long run. What could possibly happen? So let's talk about a few common nail diseases that you will encounter as a nail professional. The first one is going to be a fungal infection. It is known as onychomycosis. It's a nail infection. So the visualization of this nail, it is a fungal nail up close. The signs are going to be, it's yellow, it's brown, it's thickened, crumbly, lifting. This is a no-go, no service for this type of nail. Another type of nail you might see is called a white superficial onychomycosis. So this is where the nail is chalky white, it has patches on the surface, powdery spots that it can be scraped. This is something that we definitely also don't want to work on. The next one is called paronychia. This is red, swollen in the nail fold. It sometimes may or may not have pus. It's going to be very tender, swelling, and it is very much infected. You should not be providing services for this nail. So then we can have a chronic paronychia nail. So this is usually a thickened nail. It's red by the cuticle area and it sometimes has fungal involvement. We should not be working on this type of nail as well. So the next one you are a little familiar with, I just previously mentioned it, is called the green nail syndrome. This is a yellowish greenish discoloration nail, usually from pseudomonas, and we don't want to service this client. If you file or buff this lightly, superficially, and it doesn't come off, at least 75 to 80%, you want to stay away from that and wait till that grows out and it heals itself before putting any type of nail enhancement on it. Then lastly, we have any type of warts. These are wart growths that usually are around the nail fold. You don't want to touch these clients. It's viral and it's highly contagious, and you should not be working on them. So now let's go over some common types of nail disorders that you will encounter as a nail technician. And remember that you can work on these nails, but definitely proceed with caution. And also, if any one of you feel uncomfortable, even though you can work in these situations, if you are a beginner nail tech and you encounter one of these disorders, it's definitely and perfectly fine to say, you know, I don't feel comfortable. I rather this grow out, heal. You go to the doctor, explain yourself. You are not forced to provide services. These just simply mean you can possibly provide to these nail disorders. So the first one is nail psoriasis. So this is pitting, ridges, discoloration. You can service these clients, but you need to handle it very gently. Then we have yellow nail syndrome. So this is different from the green nail. So again, this type of greeny nail, it goes from several stages. It'll start a little yellowy, it'll get to green, it'll get to brown, then it'll get to black. The darker it is, the more dangerous it is, the more harmful it is for the client, and the more that the infection has spread. So when it is in its yellow stages, that is super early on, and you can work on these clients, but just take a look at it again, file it, and just be very mindful. If you notice anything that looks abnormal about it, definitely refer them to a doctor. Then we have onycholysis. This is nail plate lifting. So if the nail plate is lifting from the nail bed, you can work on it, but I would highly recommend shorten enhancements or a manicure or something, because remember that nail plate is not attached to the nail bed all the way. So if she bangs her finger with 4XL nails, that nail is gonna fly all the way off, and she's gonna lose that entire nail plate, and she's gonna have a lot bigger issue to deal with than what she came in with. So just be very mindful and explain that to them. Again, ma'am, wait until this grows out and I can do what you want, or we can do them short. The next one is called Buse lines, and these are horizontal ridges in the nail, and you can work on them. You can smooth it and put nail polish or an enhancement on as normal. Some people are scared of nails like this. You just want to use a nail file 240, something very high, very fine, so that you're not too aggressive on top of the nail plate. The next one looks harmless, but it's really not. Leukonychia is just white spots, simply stated, and it's again harmless. You can proceed and provide any type of service to these type of clients. The last one is called nail pterygium, and this is skin overgrowth. So you can service this type of nail, but we just want to make sure that we are not cutting any type of living skin. We don't want to harm the client. So this next section, I wanted to throw into this video a couple of things, what I call like benign nail variations. So these are the things that are not unhealthy at all. And while they may look a certain way, and if you are unknowledgeable or if your clients ask you about them, I wanted to just discuss a couple nail situations that you might encounter that wouldn't really fall underneath nail disorder or disease. So the first one is, I think people ask this question the most about this nail. It's called melanonychia. And melanonychia is simply brown or black streaks running lengthwise across the nail plate. It can also just be the entire nail plate as well. I have seen that. All it is increased melanin production in the nail matrix. That is it. It is normal. It's actually common in darker skin tones. You'll see this a lot of times in Black people. It's very harmless. However, if you do notice it in someone that is white or Caucasian, it can be signs of something else. I, in my whole entire work experience, have yet to see that in someone that was white or Caucasian. I've only seen it in a lot of African American Black people. These nails are perfectly fine to work on. The only thing is you just want to maybe help them and guide them in a color choice, especially if someone that has melanechia in a toenail or fingernail and they want to do French. You might need to provide a certain nude that is going to camouflage their toe. But honestly, most people that have a nail or a couple of nails or streaks like this, they are aware of it, they can see, and they'll ask you, do you have anything that can cover this? The next one is a transverse ridges. So this is when you'll see some type of shallow horizontal grooves into the nail. This could easily just come from a bump or injury. We just would lightly smooth out the nail, buff it again with a 240 or fine file or buffer, and we can proceed. There's nothing wrong with it. This is usually after a nail had its injury, it grew out and possibly changed from the matrix, and now this is how this nail will always grow out. I've seen that after an injury, this is how the nail always grows out. Sometimes I've seen it grow out, and then once it goes all the way to the free edge and you get there, it'll grow back out normal. You'll be able to tell when you see the new growth of the nail if it's going to be a permanent thing or a temporary thing, but you can work on these nails. They're perfectly fine. The next one is called spoon nails. So this is when nails actually have an actual spoon shape and they curve upward. It could possibly just be from someone that's working with their hands a lot, working in water a lot, or they have mild anemia. These nails are perfectly fine to work with. There's nothing wrong with them. We just want to be mindful of the type of service that we're providing and handling the type of nail and filing. The last one is going to be your nail bedding. So these are basically just nails that have ridges, and it could be caused from some type of genetics or anything, but they are perfectly fine again to work on. We want to gently buff and possibly provide some type of hydration for these nails. I want to also point out that the pictures that I have provided within this video are just examples that I have pulled from online. They may or not be exactly like the type of situation that you might encounter. So use your professionalism, your education, and your own judgment in deciding should you or should you not service your clients. And if you are ever unsure, always stop what you're doing and refer them to a doctor. So as a nail professional, it's not always about pretty nails, it's about safe nails. And recognizing when to stop is not only going to protect you, but also your clients and your license. If you guys have any other questions, please do not hesitate to leave me a comment down below. Thank you so much for watching. Bye.